Bone pain, causes and symptoms. The definition of bone pain is aching, tenderness, or another discomfort in the bone. Bone pain is one of the most common symptoms of bone cancer, so people should not overlook it. The most significant cause of bone pain is bone cancer. This disease is most likely to occur in the long bones of the upper arms or legs, but it may affect any bone. When cancer cells originate in the bone itself, this is called primary bone cancer. Pain caused by bone cancer may have the following symptoms: an initial sense of tenderness in the bone, escalation to a constant pain or a pain that comes and goes in the affected bone, persistent pain during the night and when at rest. What are the other potential causes? There are many other possible causes of bone pain, which include arthritis, secondary or metastatic bone cancer, which is cancer that has spread to the bones after developing in another part of the body, a fracture following an accident or another trauma injury, an infection, leukemia, a type of cancer that starts within the bone marrow, a bone infection called osteomyelitis, osteoporosis, a condition in which a deficiency of calcium and vitamin D causes bones to be fragile, interruption of the blood supply to the bones, as occurs in sickle cell anemia, a fracture caused by a twisting injury that usually occurs in toddlers, known as toddler's fracture, growing pains in children and teenagers, excessive use. Bone cancer symptoms. In addition to bone pain, the possible symptoms of bone cancer are swelling or inflammation, redness in or around the affected area, a lump over or near the affected bone, bone fractures after just a small injury or fall, because cancer has made the bones fragile. Less common symptoms may also include fever or chills, fatigue, unexplained weight loss, sweating, particularly at night. Treatment options for bone cancer. Treatment aims to relieve pain, mend any fractures, and prevent or delay further bone complications. There are different treatment approaches for bone cancer depending on its type and how far it has spread in the body. This includes surgery, involves removing the cancerous portion of the bone. Where possible, the surgeon will rebuild the bone after surgery, but sometimes they will need to amputate part of the bone. Chemotherapy, a cancer treatment that uses drugs to kill the malignant cells and tissues. Radiotherapy, a cancer treatment that uses radiation to destroy cancer cells. Mifeprintide, a drug used to treat osteosarcoma, a specific type of bone cancer. This treatment stimulates the body's immune system to attack and kill cancer cells. Treatment options for other causes. Treatment for non-cancerous bone pain depends largely on the cause of the pain. A doctor's diagnosis will determine the treatment, which may consist of anti-inflammatories, antibiotics, painkillers or analgesics, hormones, calcium and vitamin D supplements for osteoporosis, anticonvulsants where bone pain is nerve related, corticosteroids, antidepressants,